People think medicine is all about memorizing textbooks, but it's not. Real medicine is high-stakes detective work. It's about finding clues, spotting patterns, and making the right call when a life is literally on the line. So, let's dive in and see how it's done.
So, picture this. It's you. The clock is ticking, the pressure is on, and one single decision could change absolutely everything. It's a pretty daunting question, right? But the answer, well, it's always the same.
See, every single diagnosis is a puzzle. Every symptom, every lab result, every little detail of the patient's story is a potential clue. Our job today is to sift through 10 fascinating cases and see how clinicians piece all these clues together to find the truth, starting with the ones where you have to think the fastest.
All right, in our first set of cases, time is the enemy. It's not just about getting the right answer, it's about getting the right answer right now. This is where speed and knowing your priorities are absolutely everything. Our first case is a perfect lesson in triage, and it's all governed by this, the Advanced Trauma Life Support Survey. This is like the non-negotiable playbook for any major trauma. You go in order. A for airway, B for breathing, C for circulation. Now here's the crucial part, and you can't forget this. You have to solve a B problem before you even think about a C problem.
Okay, so in this trauma case, right, the patient has a bleeding scalp laceration, maybe some internal injuries. Those are C for circulation problems. But they've also got a pneumothorax, a collapsed lung, and that's a B for breathing problem. And a B problem is going to kill them way faster than a C problem. So what does this tell us? You actually ignore the bleeding for a moment and you put a chest tube in. You secure the breathing first, always.
Let's move to our next case. A woman, 33 weeks pregnant, gets into a car accident and starts bleeding. Now, it could be a few things, but they look very different when you know what to look for. This table does a great job of separating them. It's all about contrast. Our patient has a tense, painful, contracting uterus. That single clue points us away from the painless, bright red bleeding of placenta previa and squarely towards a placental abruption. The puzzle pieces just click into place.
Sometimes the clues aren't subtle at all. Sometimes they are screaming the diagnosis at you. And that's our next emergency. A mother's water has broken at term, and now she has a fever and chills. This isn't some deep mystery. The pieces are all right there on the table. This is chorioamnionitis, an infection of the amniotic fluid that can be life-threatening for both mom and baby. And the only way to truly treat it is to remove the source of the infection. You have to induce labor immediately.
Okay, let's slow down the clock a bit. For our next set of cases, the challenge isn't pure speed, it's depth. This is all about pattern recognition, connecting seemingly unrelated dots to uncover a hidden diagnosis. Our next case is just a beautiful example of how anatomy can literally tell you the diagnosis. An elderly patient gets whiplash in a car accident. Afterward, he finds his arms are incredibly weak, but his legs are mostly fine. This very specific pattern is the hallmark, the dead giveaway, for central cord syndrome. Think of the spinal cord like a cable. The fibers that control the legs run on the outside, and the ones for the arms are on the inside. The injury bruised the very center of that cable, damaging the arm fibers while sparing the legs. The pattern reveals the exact location of the problem.
Okay, let's look at our next patient. They have cancer of the esophagus. But which type? This really shows why a patient's history is such a critical clue. We learned they've had chronic acid reflux for years. Looking at this slide, we can see that acid reflux is strongly linked to adenocarcinoma, a cancer in the lower esophagus. In contrast, smoking and alcohol are linked to squamous cell carcinoma, a cancer higher up. That one piece of their history is the key to the whole diagnosis.
And hey, here's a little memory trick to lock that information in. Just remember the 3 A's. Adenocarcinoma is in the anterior/lower esophagus and is caused by acid reflux. A simple mnemonic that can help a clinician get to the right answer that much faster. Now for a real head-scratcher. In our next case, a young woman who recently gave birth has some strange bleeding, and her uterus is still enlarged. That's a little weird, but maybe not alarming on its own. But then you get a chest x-ray, and it shows spots in her lungs. So, what on earth could connect postpartum bleeding to spots on a lung x-ray? This is a tricky one. And the answer comes from a single blood test. Beta-HCG. Yeah, the hormone of pregnancy. But in this case, it's not just elevated, it's markedly elevated. Sky high. This is the aha moment. This isn't a leftover pregnancy, it's a rare cancer that arises from placental tissue called choriocarcinoma. It explains the uterine issues and why it is spread to the lungs. One single test just cracks the entire case wide open.
Here's another case where one clue changes everything. A young man is being evaluated for infertility, and during the physical exam, the doctor discovers a very specific, very unusual finding. The vas deferens, the tubes that carry sperm, are absent on both sides. They're just not there.
This finding has a special name in medicine. It's pathognomonic. And what that means is, if you see this one sign, it points so strongly to one specific diagnosis that the mystery is essentially solved. The bilateral absence of the vas deferens is pathognomonic for cystic fibrosis. Even if the patient has no lung problems at all, this one physical finding tells you the root cause of their infertility. You confirm it with a sweat chloride test, and the case is closed.
For our final set of cases, the detective work is a little different. It's not always about solving a novel mystery. Sometimes it's about knowing the rules, the evidence-based guidelines, and applying them correctly. It's like cracking a code that's already been written for you.
Let's take our next case, a patient with a new diagnosis of severe asthma. There's no real mystery here. The evidence and guidelines are crystal clear, so you just follow the protocol. You start with a reliever inhaler for immediate symptoms, add a regular low-dose steroid controller to manage inflammation, and give a short burst of oral steroids to get things under control quickly. It's all about following the playbook.
Now, what's really interesting about this next slide is the principle it reveals. We have a patient with type 2 diabetes and high blood pressure. Their cholesterol numbers might even be totally normal, but the guideline is absolute. You start a statin, period. Why? Because for this high-risk population, statins aren't just for lowering cholesterol. They're for preventing heart attacks and strokes. The treatment is based on the patient's entire risk profile, not just the single lab number.
Finally, our last case. A pregnant woman has a Pap test showing high-grade cervical changes. And that sounds terrifying, right? But again, there's a clear code to follow. You don't panic. The code tells you to investigate, which is safe to do with a colposcopy and a small biopsy. But, and this is key, it also tells you to defer any major treatment like a cone biopsy until after the baby is born to avoid any risk to the pregnancy. The rules provide a safe pathway through a very scary situation.
So after walking through these 10 cases, what have we really learned? Well, it turns out that all this complex detective work can be broken down into a few core principles. This is the clinician's toolkit for solving pretty much any puzzle.
First, triage. You always address the immediate threat first, like with a pneumothorax. Then you've got pattern recognition, connecting the dots that others might miss, like how weak arms but strong legs means a central cord injury. You have to contrast and compare to tell the difference between lookalikes, like the different causes of bleeding or types of cancer. You hunt for that one aha clue, the sky-high beta-HCG or the absent vas deferens that unlocks the whole case. And finally, you know the code is your guide. You know and apply the evidence for things like asthma or statins.
These principles aren't just for doctors. They're a way of thinking, a way of taking complex information, sorting through all the noise, and finding the signal. We've just analyzed 10 critical cases. The next puzzle you encounter in any part of your life is waiting. Will you be ready to spot the clues?